Welcome back to the channel. If you are new here, we focus on health information that matters most for adults over 60. Real information, no gimmicks, just science-backed knowledge delivered in a way that actually makes sense. Today we are talking about something that affects over 20 million Americans, and yet most people have never even heard the word until their doctor says it to them. That word is neuropathy. Peripheral neuropathy, to be specific. Now, neuropathy simply means nerve damage. Peripheral means the nerves outside your brain and spinal cord, the ones that run through your hands, your feet, your arms, your legs. These nerves are responsible for sensation, for movement, for telling your brain whether something is hot or cold, sharp or soft. When these nerves get damaged, things start going wrong. And the tricky part? The damage often starts so quietly that most people do not realize anything is wrong until the condition has already progressed significantly. Here is what most people do not know. While diabetes is the #1 cause of neuropathy, there is another major cause hiding in plain sight. Toxins. Common, everyday toxins that millions of seniors are exposed to without even knowing it. And these toxins could be slowly, steadily eating away at the protective coating around your nerves, like acid dripping on a wire, until the signals just stop getting through. Today, I am going to walk you through exactly what these toxins are, where they are hiding, and most importantly, the early warning signs of neuropathy that you absolutely should not ignore. Because when it comes to nerve damage, early detection is not just important, it is everything. Let us get started. Before we talk about toxins, let me help you understand why your nerves become more vulnerable as you age. Think of your nerves like electrical cables running through your body. Each nerve fiber is coated with a protective layer called the myelin sheath. Think of it like the rubber insulation on an electrical cord. That coating keeps signals moving fast and clean from one point to another. Now, as you get older, especially past the age of 60, that protective coating naturally begins to thin. Your body's ability to repair damaged nerves slows down. Blood flow to the tiny vessels that feed your nerves decreases. Your immune system becomes less efficient at fighting off inflammation. So your nerves are already in a more fragile state. Now imagine introducing a toxin into that equation, a substance that actively attacks nerve tissue, strips away that protective coating, or triggers chronic inflammation that damages nerves over time. That is when things go from normal aging to a serious medical problem. And the scariest part? Many of these toxins are things you encounter every single day. Let us talk about the toxins. And I want you to pay close attention here, because some of these are going to surprise you. The first toxin is alcohol. Now, I know what some of you might be thinking. I only have a glass of wine with dinner. And look, moderate alcohol consumption may be fine for many people. But here is the truth that often goes unspoken. Alcohol is directly toxic to nerve tissue. It does not need to be excessive drinking. For some seniors, especially those who are already dealing with nutritional deficiencies or other health conditions, even moderate, long-term alcohol use can contribute to nerve damage. Alcohol damages nerves in two ways. First, it has a direct toxic effect on nerve fibers. Second, it interferes with your body's ability to absorb critical B vitamins, particularly vitamin B1, also known as thiamine, and vitamin B12. These vitamins are absolutely essential for nerve health. Without them, your nerves begin to deteriorate. If you have been a regular drinker for decades, even at what you consider a reasonable level, and you are starting to notice tingling or numbness in your feet or hands, this connection is worth exploring with your doctor. The second toxin is heavy metals. This one is more common than you think. Lead, mercury, arsenic, cadmium. These heavy metals are found in older plumbing, contaminated water supplies, certain fish, rice, some imported spices, and even in the soil around older homes that were painted with lead-based paint decades ago. Many seniors living in older homes built before 1978 have been exposed to low levels of lead for years without knowing it. And mercury, which is found in certain types of fish like swordfish, king mackerel, and tilefish, accumulates in the body over time. These metals do not just pass through your system. They build up. And over years, even low-level chronic exposure can cause significant nerve damage. The symptoms often mimic other conditions, which is why heavy metal toxicity is frequently overlooked, especially in older adults. The third toxin is certain medications. Now this one is critical, and I want you to listen very carefully. Some of the most commonly prescribed medications for seniors can cause neuropathy as a side effect, and many people have no idea. Statin drugs, which are used to lower cholesterol, have been linked to peripheral neuropathy in some patients. Certain antibiotics, particularly a class called fluoroquinolones, brand names like Cipro and Levaquin, are known to cause nerve damage that can sometimes be permanent. Some blood pressure medications, certain chemotherapy drugs, and even long-term use of the diabetes medication metformin, which can deplete vitamin B12 levels, have all been associated with nerve damage. Let me be very clear. I am not telling you to stop taking your medications. That would be dangerous. What I am telling you is to have an honest conversation with your doctor. Ask specifically, could any of my medications be contributing to nerve problems? You have every right to ask that question, and a good doctor will take it seriously. The fourth toxin is pesticides and herbicides. If you have spent years gardening, farming, or living in agricultural areas, you may have been exposed to organophosphates and other chemicals found in common pesticides and herbicides. These substances are known neurotoxins. They were literally designed to attack the nervous systems of insects. And in humans, chronic low-level exposure can damage peripheral nerves over time. Even household insect sprays, lawn treatments, and certain cleaning products contain chemicals that can be harmful to nerve tissue with prolonged exposure. The fifth toxin is industrial and environmental chemicals. If you worked in manufacturing, construction, painting, printing, dry cleaning, or automotive industries during your career, you may have been exposed to solvents like toluene, hexane, or trichloroethylene. These industrial chemicals are well-documented causes of peripheral neuropathy. The damage may not show up until years or even decades after exposure, which is why many retirees are only now experiencing symptoms from exposures that happened 30 or 40 years ago. Now that you know what might be causing the damage, let us talk about the warning signs. Because catching neuropathy early, before it becomes severe, gives you the best chance of slowing it down, stopping it, and in some cases, even reversing it. The first sign is tingling or pins and needles in your feet or hands. This is usually the very first sign. It often starts in the toes or the balls of your feet. Some people describe it as a buzzing sensation. Others say it feels like their foot fell asleep and never fully woke up. Many seniors dismiss this as poor circulation or just getting old. But persistent tingling that does not go away is your body sending you a signal. Your nerves are talking to you. Please listen. The second sign is numbness that gradually spreads. The tingling might eventually give way to actual numbness. You might notice you cannot feel the texture of the carpet under your feet, or you might not feel a small cut on your toe. This numbness typically starts at the extremities, the tips of the toes, the tips of the fingers, and slowly moves upward. Doctors call this a stocking and glove pattern because the numbness follows the areas that would be covered by stockings and gloves. This is a serious sign. When you lose sensation in your feet, you become much more likely to fall. You might not notice injuries. And for seniors, a fall or an unnoticed wound can lead to devastating complications. The third sign is burning or shooting pain. Some people experience the opposite of numbness, intense, burning pain, often described as feeling like their feet are on fire, or sudden, sharp, shooting pains that come out of nowhere. This type of nerve pain, called neuropathic pain, can be excruciating. It often gets worse at night, making it difficult to sleep. If you are lying in bed and your feet feel like they are burning even though they are cold to the touch, that is a classic neuropathy symptom. The fourth sign is increased sensitivity to touch. This one confuses a lot of people. You might find that even light touch, the weight of a bedsheet on your feet, socks that never bothered you before, or someone gently touching your hand, suddenly feels painful or extremely uncomfortable. This is called allodynia, and it happens when damaged nerves start sending exaggerated pain signals to the brain. The fifth sign is muscle weakness or cramping. When the motor nerves, the nerves that control movement, become affected, you might notice weakness in your hands or feet. Maybe you are having trouble opening jars. Maybe you are tripping more often because your foot is not lifting properly when you walk, a condition sometimes called foot drop. Frequent muscle cramps, especially in the legs and feet, can also be an early indicator. The sixth sign is balance problems and unexplained falls. If you are over 60 and you have started losing your balance more frequently, or if you have had unexplained falls, neuropathy could be the hidden cause. Your nerves are responsible for proprioception your body's ability to sense where it is in space. When those nerves are damaged, your brain loses accurate information about the position of your feet, which makes balancing much harder. Many seniors are told they are just getting unsteady with age, when in reality, treatable nerve damage is the culprit. The seventh sign is digestive problems, dizziness, or changes in sweating. This might seem unrelated, but neuropathy does not only affect your hands and feet. It can also damage the autonomic nerves, the ones that control your internal organs. If you are experiencing unexplained constipation, bloating, nausea, dizziness when standing up, difficulty regulating body temperature, or unusual sweating patterns, autonomic neuropathy could be involved. These symptoms are often attributed to other conditions, and the nerve connection is missed entirely. Now, let me pause right here for just a moment. If you are over 60, or if you are caring for an elderly loved one, this information could genuinely be life-saving. Neuropathy is not just about discomfort. Untreated nerve damage can lead to falls, infections, amputations, loss of independence, and a dramatic decline in quality of life. But it does not have to go that way. If anything in this video has resonated with you, if you recognized even one of these signs in yourself or someone you love, please do not ignore it. And please share this video with your family, your friends, your spouse. Because the more people who know about this, the more lives we can protect. And if you have not already, go ahead and hit that subscribe button. We put out videos like this every week, specifically designed for adults over 60 who want to stay healthy, stay informed, and stay in control of their lives. All right, let us keep going. Because knowing the signs is only half the battle. Now let us talk about what you can do about it. First, see your doctor and ask for specific tests. Do not just mention tingling in passing during a routine visit. Be direct. Tell your doctor you are concerned about peripheral neuropathy and ask for a nerve conduction study. This is a simple, non-invasive test that measures how fast electrical signals move through your nerves. It can detect damage even in the early stages. Also ask for blood work that checks your vitamin B12 levels, blood sugar and hemoglobin A1C, thyroid function, kidney function, and a complete blood count. If there is any suspicion of heavy metal exposure, ask for a heavy metals panel. These tests can help identify the underlying cause, which is absolutely critical for treatment. Second, review your medications. Bring a complete list of every medication and supplement you are taking to your doctor and ask, one by one, whether any of them could be contributing to nerve damage. This includes over-the-counter medications and supplements. Sometimes a simple medication adjustment can stop the nerve damage from progressing. Third, reduce your toxin exposure. If you are still drinking alcohol regularly, consider reducing or eliminating it, especially if you are showing signs of neuropathy. Have your home water tested for heavy metals, particularly if you live in an older home. Be cautious with pesticides and chemical products. Wear gloves when handling chemicals. Choose organic produce when possible to reduce pesticide exposure. If you eat fish, choose lower mercury options like salmon, sardines, and tilapia instead of high mercury fish like swordfish or shark. Fourth, focus on nerve-supporting nutrition. Your nerves need specific nutrients to function and repair themselves. Vitamin B12 is arguably the most important. Many seniors are deficient in B12 without knowing it because the body's ability to absorb it from food decreases with age. Good sources include eggs, dairy, fish, and fortified cereals. Your doctor may recommend a B12 supplement or even B12 injections if your levels are low. Vitamin B6, vitamin D, magnesium, omega-3 fatty acids, and alpha-lipoic acid have all been shown to support nerve health. Alpha-lipoic acid in particular has been studied for its ability to reduce neuropathy symptoms and is widely used in Europe as a treatment for diabetic neuropathy. Always talk to your doctor before starting any new supplement, especially if you are on medications. Fifth, stay physically active. I know this can be challenging when your feet hurt or your balance is off, but gentle, regular exercise is one of the best things you can do for your nerves. Walking, swimming, chair exercises, tai chi, and gentle yoga can all improve blood flow to your nerves, reduce inflammation, and even stimulate nerve regeneration. Exercise also helps control blood sugar, reduce stress, and improve sleep, all of which benefit nerve health. Even 15 to 20 minutes a day can make a meaningful difference. Sixth, manage your blood sugar. Even if you have not been diagnosed with diabetes, Ask your doctor to check your blood sugar levels. There is a condition called prediabetes, where blood sugar is higher than normal, but not yet in the diabetic range, and it can cause neuropathy too. Many people are walking around with prediabetes and have no idea. Controlling blood sugar through diet, exercise, and when necessary, medication is one of the most effective ways to prevent and manage neuropathy. Seventh, protect your feet. This is practical advice that can prevent serious complications. If you have any numbness in your feet, check them every single day for cuts, blisters, sores, or redness. Wear well-fitting, supportive shoes. Never walk barefoot, even at home. Keep your toenails trimmed carefully. Moisturize your feet to prevent cracking. These simple habits can prevent infections and injuries that you might not feel due to nerve damage. Now, one of the most common questions I hear is whether nerve damage can be reversed. And the answer is, it depends. If neuropathy is caught early, and if the underlying cause is identified and addressed, nerve damage can sometimes be partially or even fully reversed. This is especially true in cases where the neuropathy is caused by a vitamin deficiency, medication side effect, or toxin exposure that can be eliminated. However, if the damage has progressed significantly, or if the cause is not addressed, the damage can become permanent. That is why early detection is so critical. Every month you wait, every sign you ignore, you are giving the damage more time to become irreversible. Your nerves have the ability to heal, but they need your help. They need you to pay attention, take action, and give them the support they need. Let us bring everything together. Today we talked about a topic that affects millions of seniors, but is far too often ignored or misunderstood. We talked about how common toxins, alcohol, heavy metals, certain medications, pesticides, and industrial chemicals can silently damage your nerves over time. We walked through 7 early warning signs of neuropathy: tingling, numbness, burning pain, sensitivity to touch, muscle weakness, balance problems, and autonomic symptoms that should never be brushed aside as just normal aging. And we covered practical, actionable steps you can take right now: getting tested, reviewing your medications, reducing toxin exposure, nourishing your nerves with the right vitamins and nutrients, staying active, managing blood sugar, and protecting your feet every single day. Here is what I want you to take away from this video above everything else. Your body talks to you. Those little sensations, that tingling in your toes, that numbness in your fingertips, that burning in your feet at night, those are not random. Those are messages. Your nerves are asking for help. And the beautiful thing is, it is not too late. No matter your age, no matter how long these symptoms have been going on, there are steps you can take today, right now, to protect your nerves, slow the damage, and in many cases, start healing. You have spent your whole life taking care of others, your family, your children, your grandchildren. Now it is time to take care of yourself. You deserve to walk without pain. You deserve to feel the warmth of your grandchild's hand in yours. You deserve to move through your golden years with strength, confidence, and comfort. Do not let a silent toxin steal that from you. If this video helped you, or if you learned something new today, please hit that like button. It is a small thing, but it helps us reach more seniors who need this information. Subscribe to the channel if you have not already, and tap the bell icon so you never miss a new video. We are here for you every single week with health information that matters. Share this video with someone you care about. Send it to your spouse. Send it to your adult children. Post it in your family group chat. You never know whose life you might be protecting. And I would love to hear from you in the comments. Have you experienced any of these symptoms? Have you been diagnosed with neuropathy? What has helped you? Your story could inspire someone else who is going through the same thing. Thank you for watching. Thank you for trusting me with your time and your health. Take care of those nerves. Take care of yourself. And I will see you in the next video.